So the first time, and Maitland trained people would say 3 passes. 3 times, 3 passes, whatever term you want to use. So the first one is grade 1s and 2s, and that with that assessment, you're pretty much maybe letting the patients know what you're doing, where you are, and then just looking for the tissue response, right? You're not into the resistance, so you're less likely to get, well, you're not going to get to the end feel, right? So you're not assessing for quality of motion, quantity of motion, end feel, all that. But if they can't even tolerate that, then that will tell you something that perhaps this patient is either something really going on with them that you need to kind of step back and reassess, or they're maybe perhaps hands-off people. Okay? So that's their first, grade 1s and 2s. So starting out with 1, okay, doing good. Actually, you're doing good? Okay, I'm going up all the way to L1. That was my first pass, I guess. The second one is grade 2s and 3s. Oh, the first one was 1s and 2s. The second one is 3s and 4s. Okay, let me get my grades straight here. So now, same thing. Start from one end and go up. You doing good? Yes. Okay. You can pick 3, 4, or start with 3, go into 4, however you want to do it. But here you're paying attention to the quality of the motion, the quantity of the motion, and all that. Okay? As you're doing 3s and 4s, you're again talking to your patient. They might be okay with 3, they might be okay with 4. You have to make that note, because then that will help you determine what grade you really want to use as a treatment, if you want to do this as a treatment. Some people use that. And then the third one is, so let's say I start here and Ashley's like, okay, that's painful. And I kind of felt like it was stiff too. I move up, okay, we're good. Okay, that's also painful, perhaps. Okay, so I make a note, and then with the third pass, I confirm. Yes, it was this level, it was that level. And then I ask her, you don't have to do the entire thing, you can go, both of those, you can target those 2 segments and say, okay, how does this feel, or compared to the one above or one below. So basically, with the third pass, you're trying to determine which segment you need to treat that day, if you feel like this is the treatment you need to do. Again, Maitland trained therapists use this a lot as treatment. That's considered the gold standard. A lot of people use it, you guys. Okay? We got it? Okay. So you made a note about it. You can practice on each other when you get together. Let's move on to the unilateral PA now. Are there any questions so far? Everything clear? Okay. With unilateral, you're not on the spinous process, because that's what we just did is considered central PA, central posterior to anteriorly directed pressure. With the unilateral, you're always assessing and or treating the side you're standing on, not across. Okay? And you find the spinous process. So I start out with my landmark, iliac crest. I think I'm at L4, maybe L5. I'll figure that out. Now, I'm on the spinous processes. I use my thumb, and thumb width away, I think I am on the facet joint. Okay. Got it? So basically, where are the facet joints? Well, we really don't know for sure, you guys. We think we're on facet joints, but they're pretty close to the spinous processes. They're not that far away. So don't get confused between the facet joints and transverse processes. But good landmark is a thumb width away. And then hand position for all grades is thumbs not the ulnar border. So grade 1 and 2 will look just like that you just completed with central PAs. And 3s and 4s, same hand position, and I'm going to go deeper in. And you may have to kind of move around a little bit, and this is really hard to feel because you're going through muscles. And then, but you will get to the point where you feel like, okay, I'm no longer pushing through the muscles. I feel a bony lock. Okay. And then do this. So grade, how will you assess it as a full assessment? Grade 1s and 2s, 1s and 2s, 3s and 4s, 3s and 4s, right? Okay, and then confirm. So it's important to have your thumb positions correct. Try not to hyperextend. No nails. They have to be like this because you will be using this position to do 3s and 4s if you believe this is a good treatment method for this individual. And there are conditions when these treatment methods are used and they're very beneficial. Okay, can we practice that?